Welcome to RMD Podcast with me, your host, Dr. Debra Durst, and I have my co-host with me.
Hello, my name is Farideh Golembieski, and I am a board-certified family nurse practitioner.
So I am a regenerative medicine specialist, and we have a practice, RevitalyzeMD, in Knoxville that specializes in regenerative medicine, but with a focus on sexual wellness. So we have a podcast, RevMD Podcast, that has lots of videos related to sexual wellness, but we also have this podcast, RMD, that is a focus on wellness and regenerative medicine. And so today we are going to just talk about nitric oxide production. Why all the hype? What is it? What are the benefits? What happens with age? And that's what we're going to talk about. Just overall, how does nitric oxide help your wellness and your health?
We know nitric oxide plays a critical role in the body. And just to kind of add to that, we do have another podcast that we have done that should be out as well on female sexual wellness and the benefits of nitric oxide for women. So check that one out.
Yes.
Sorry, Dr. Durst, go ahead.
No.
That one was a fun podcast, so I want
Yeah.
to make sure we mentioned it.
And that is specific to the sexual wellness
Yes.
in women and blood flow and how that improves, right?
Yeah.
With
So
nitric
now we
oxide.
can go into just overall all the benefits.
So nitric oxide is talked about a lot. I think that women talk about this less than men do. And I think that is because over time, men have been using supplements that have increased nitric oxide to improve their workouts and muscle and blood flow. And then it also improved erection and blood flow and erectile tissue. And so that has been a huge discussion with men, but it can actually increase blood flow with women too. And so what we're going to talk about is nitric oxide. How is it produced in the body? What is it and how is it produced? So nitric oxide is naturally produced by the body. Two pathways. One is enzymatic, one's not. So that's a fine detail of science, but really there's two pathways and one can decrease. That enzymatic one takes an amino acid like L-arginine, and it actually uses an enzyme called nitric oxide synthase and produces nitric oxide. And it's done in various tissues, and endothelium or the blood vessel wall is one of those tissues that the eNOS is present in. So therefore, if you have increased nitric oxide production in those endothelial cells or the blood vessel wall, then you have a vasodilation, which means your vessel gets larger and you have increased blood flow to the tissue. So another one can be
The
neurons.
neuronal. Yeah, neurons.
Yeah. So you'll have a different, again, it's still the same enzyme, but it's present in nerve tissue. And so with that one, you're increasing, your nitric oxide production. And in our previous podcast that you bring up, we talked about that specific thing. It helps with cognition and memory. So if you want to learn things better and you want to retain that, then nitric oxide production in your brain is important.
And then it's also in immune cells.
Yes.
So we have a benefit there as well.
So again, those same enzyme, different cell line, and with that, you're going to control inflammation and you're going to fight infections better. So there's multiple reasons why you want to have nitric oxide production, and that just goes into a specific enzyme location in the body and different tissues. Then there's also the non-enzymatic pathway.
Yeah, and that one we're getting through dietary supplement. So that's through our foods, through foods that are rich in nitrates and nitrites.
If you think about greens, so beets are one of them, but greens, and a lot of different greens, if you're talking about like arugula is one of those. It's one of my favorite, green veggies.
Chard, what are those? The thicker, leafier greens.
Yes, and celery. Anything that pretty much has greens in it would potentially have, but beets are another one that's huge. And it's usually not very common. I think that everyone takes in a lot of beets per day. So there's some supplement at the end that we'll talk about that can help you with that nutrient related pathway. So the important thing is that the enzyme pathway decreases with age. And it can decrease up to 50% by the age of 40, which is significant. So nitric oxide production by that enzymatic pathway is significantly decreased, so you need the nutrient pathway to be active.
Absolutely. So there is a lot of talk about L-arginine and taking supplements to increase nitric oxide, specifically L-arginine. So that has been around for a while. I've heard many guys talk about, oh, I take L-arginine, I take it before a workout. It's part, or oh, nitric oxide's part of my pre-workout, or it's been in the gym, right? There's gym talk around it. But those guys and women that are out there, because it's not just guys, men and women that are taking L-arginine and you're over the age of 40, the likelihood that that L-arginine is still converting appropriately to nitric oxide decreases significantly. So that's where we're talking about getting it from your foods. So there are supplements, nobody wants to eat 5 pounds of raw spinach multiple times a day to get a nitric oxide boost. So, or as you said, your favorite, arugula, I can do a serving of it with dinner, but I'm not going to eat salad all day long to get that boost. So there are supplements that are made from those foods to help convert.
And we'll also put those food items in the link, the description notes, so that you can just see all the different foods that have nitrates in them. So the fact that it decreases with age, what are some of the things that cause that? Hormonal changes is one of them, because there's lots of nitric oxide production that are dependent upon hormones such as testosterone or estrogen. So if those decrease, then you'll get decreased nitric oxide production. Oxidative stress.
I was going to say a lot of oxidative stress.
So if you aren't familiar with what that means, really what you're talking about is all the toxins we're exposed to. Anything that causes inflammation in the body is an oxidative stress.
Which then goes to inflammation.
Yes.
If you have a lot of inflammation in the body.
Decreases nitric oxide production. And there's so many toxins that we're exposed to that, again, just going outside, there's lights, there's, phone,
Plastics.
Electromagnetic radiation. There's all kinds of things that we're exposed to that can increase that. So, and dietary changes can happen. And then the enzyme just becomes less active with age. And so the result of that is that you don't get all the benefits that we're going to talk about that you get when you have nitric oxide production in the body. But the good thing is that you can maintain that nitric oxide production with the dietary pathway. So it's
not gone forever, guys.
No, it's easily correctable. And Berkeley Life is one of our favorite supplements. And we bring that up frequently, really just because we use it all the time. Almost everybody in our office is on it ourselves, staff-wise. Because
we recommend it for health. We recommend it for sexual wellness. We recommend it for blood pressure, for vascular.
Yeah.
So it is not... it's kind of a one supplement for all, and it has multiple benefits.
Yes, and such positive feedback from our patients that are on it with all the benefits. So what are the benefits? So vascular and cardiovascular health would be the first one. So nitric oxide production is very important for vasodilation and blood flow.
Yep, and it works in those endothelial cells. So it is extremely important in that aspect. So we have patients who are on multiple blood pressure medicines, and they're like, what can I do to help my blood pressure? I don't want to be on all these meds. We talk about diet, we talk about exercise, we talk about nitric oxide and increasing and taking a product like Berkeley Life. There was a double-blind placebo study that they posted on their website, which is actually really interesting if anybody wants to look at it, showing a significant reduction in blood pressures with just taking nitric oxide. So it's definitely something to check out and something to look into and ask your doctor about if you are also taking lots of blood pressure medicine. But that's a big one, is blood flow.
Mm-hmm. And relaxation of smooth muscles is it's same thing. It results in increased blood flow. But again, I think that is, if you're thinking about cardiovascular health overall, coronary artery disease, the blood pressure elevation that leads to it, this is so important that you are increasing nitric oxide, vasodilating, and relaxing the smooth muscle for that. And so we do talk about that. Magnesium is another supplement we highly recommend, in addition to the others that you mentioned. for anybody with blood pressure problems because it's great at relaxing smooth muscle, which is what made me bring that up. And that was our other podcast on sexual health in women. And of course, with men too, it increases blood flow.
And that's the name of the game when it comes to sexual health. The
Yes.
more blood flow, the better blood flow, the better overall our sexual health is.
What we don't think about with that is that the clitoris is the equivalent of the penis. So there is erectile tissue there. It is just a sexual organ, the clitoris, and that's it. And so there is erectile tissue. You want to increase blood flow, and that increases arousal and increases orgasmic strength. So it's very important to have a focus on the clitoris, and for sexual health, yes, and the vaginal canal and lubrication, and for men, harder erections. So it's pretty obvious the benefit is for both men and women, and a central theme to why you want to take nitric oxide production.
Another one is cognitive function and brain health. So we talked also in that other podcast about the sensory pathways and how it affects neurotransmitters and the benefit of nitric oxide in that role.
And then muscle health. So increasing blood flow to the muscle, you have improved oxygen delivery, better muscle recovery, all of that. And so better muscle building. Immune function. So we talked
a little bit about that already.
How it's produced in the immune cells, and that's important. Insulin sensitivity and metabolic health. So again, insulin resistance increases with age. And so you want nitric oxide production so that you have improved, again, hormonal health and neurotransmitter function in the body. And so that's important. Skin health overall. Increased
skin.
Improvement. And so there's some topical, aesthetic products that have like increased blood flow. I don't know if it was an increased nitric oxide production with it, but
see, when I think of that, I think more estrogen. I mean, there's just other topically
that's the
maybe a better
glow of pregnancy.
Yeah, maybe a little better options than some nitric oxide, but it's out there and it does have a benefit.
Well, no matter what, if you're taking it systemically, you will get
You're going to get the improvement
in blood flow. And in the other podcast, Farideh did a great job of pointing out the fact that you're increasing blood flow everywhere in good ways. And so the skin is just one of those ways.
Absolutely. So you don't need a topical.
No, you don't need a topical. But I could have swore it just prompted me to think. I thought I saw one of the combo aesthetic products topically recently that had a little.
I think you're right, and I can't remember what it is. Yeah. So maybe, I don't know, maybe I'll eat my words. Maybe in another 3 or 4 months, I'll be back on going, oh my goodness, you need nitric oxide for your face. Yeah. But right now, there are other products out there like estrogen and stuff like that are great for the face. And like Dr. Durst said, if you're taking this systemically, you're going to get the benefits everywhere because it affects all of the body.
And so respiratory is another one. So the lungs. So you're going to have just increased blood flow, better alveoli function, all of that. So there's just multiple health benefits to an increased nitric oxide production. It naturally will decrease with age because the enzymatic activity decreases with age. And so maintaining that as a nutrient support, and Berkeley Life does that, or any product that increases your nitrate intake, and that's what Berkeley Life does. It's not that you're taking nitric oxide. That does get a little confusing, and it did for me even early on, because some of the products have it almost looks like you're taking nitric oxide, but really what you're doing with Berkeley Life is taking the nitrates that are necessary for the non-enzymatic pathway to maintain nitric oxide production and therefore get all the health benefits. So
exactly. I think that's always important to point out. Yes. And there are a lot of products out there. Berkeley Life just happens to be one of our favorites just because we use it in the office and we get a lot of good feedback. Outside of that, I think it's really important to bring up is that there are test strips out there for nitric oxide. What's important with that is to see where are your levels initially, when you take nitric oxide, when you're taking the supplement, right, it recommends, you follow the package directions, right? So with Berkeley Life, I think it says to take 2. Well, if you take 2 and your nitric oxide comes up and it's great, and then it drops again in the afternoon, well, maybe you need to repeat your dose. So you're going to get confirmation. Is my nitric oxide actually coming up with this product? For some, 1 may be enough to maintain. You might take 1 in the morning and 1 in the afternoon, or do you need to take both of them, and is that enough to sustain? So it's nice because you can get some objective feedback pretty quickly with those test strips. Berkeley Life has their own. There's a lot of products out there that have their own as well. I think it's just always good to be able to objectively see
Yes,
it actually
absolutely. I
improve.
think data is good. It
Right.
helps you make decisions and guide, the decisions that you make. So, but I think the benefits are wide reaching for nitric oxide. And so let us know your thoughts on any products you might be using, anything that you want to discuss on the podcast, because we are willing to deep dive into anything wellness or sexual wellness. And thank you for tuning in.